Hi everybody, my name is Keisha Williams. This is my daughter Serena Williams, and we're gonna be demonstrating
leg exercises.
Yep, some leg exercises. So I've already done my hand hygiene. First thing you wanna do when you enter the room is do your hand hygiene. Even if you're just sanitizing your hands, you want them to see that you're actually sanitizing your hands. So I would do it when I enter the room instead of outside of the room, just because you want them to know that you are taking those necessary precautions. I am on my knees for this video because I want to be able to be at her level, and this is the only way that I could be at her level. In a hospital setting, you would be able to raise the bed so that the patient is kind of more towards your level so that you could instruct them as to what to do. In a home health setting, you don't have that privilege, but I want to be at her level, so I'm on my knees for this video. And what I'm gonna do is I'm gonna identify who I am, have her identify who she is, and then I'm just gonna go ahead and tell her that we're here to perform some leg exercises, help you with circulation, get those muscles moving, and we're gonna go ahead and start those leg exercises. So I will tell her my name is Nurse Casey. We're here to do some leg exercises. Could you verify your full name and your date of birth for me?
My name is Serena Cashel Williams. My date of birth is December 21st, 2011.
Thank you. Then I'm going to ask her if she has any drug allergies. Do you have any drug allergies?
Nope.
Then I'm going to check her wristband, make sure she is what she says she is, and just make sure that all of my identifiers are accurate, and just so that I have the right patient. Then I'm going to have her lay down flat for me in a supine position, or she could do this in a semi-powerless position. It depends on comfort. Are you comfortable? Okay, so we just want to make sure that she's comfortable so that she could get through the exercises feeling comfortable, because if you're not comfortable, then it just hurts and you don't want to do it. So we're just going to run through a couple of the leg exercises. I'm going to have my body facing towards her to kind of guide her and direct her. And if you're going to wear gloves for this, feel free to. Some people don't. And I would personally use gloves for it. But you just never know what the patient may have on their body, so it's always best to use gloves. So you would want to use gloves for that. So before you start, throw on some gloves and then you get started. So we're just gonna go ahead and get started. Okay, so the first thing I'm gonna have her do is to bend her knee, bend one knee. Hold on, you gotta wait till I tell you to do it. Yep, so she's gonna bend her knee, then you're gonna hold it and pull it towards you for 2 to 3 seconds and release, and then you're gonna do the other one, 2 to 3 seconds, and then you release, and then we're gonna continue doing that, and you might want to have them do it like at least 10 times. So she's just gonna do each knee 5 times and hold it for 2 to 3 seconds in that position, in this position, so that way we're helping that blood to circulate in the lower extremities. It just helps with the circulation of blood in the lower extremities. So she's gonna do that for 10 times in the hour at least, if she can. Simple enough to where it's like, shouldn't take that long. So you're just holding each knee 2 to 3 seconds, release, and keep that blood circulating throughout the lower body. So the next exercise that she's going to do is she's gonna do some leg extension. So we're gonna have her just extend her feet. You want to lift it and then just extending it, and then she's going to extend it down to the bed. She's going to lower it to the bed, not extend it, sorry. So she's just going to lift her legs and lower it down, lift her legs and lower it down, and she's going to do that like 5 to 10 times. Could you do that? Lift your leg up, lower it down, lift it up, lower it down. So she's gonna do that, like I said, like 5 to 10 times, and we're just gonna keep that going so that she could just continue doing it for a second. So when she extends those muscles, it helps to circulate the blood from her lower extremities to her upper body. So we're just wanting that blood to circulate, and that movement helps her blood circulate throughout the lower extremities. So the next exercise that we're gonna do is she's gonna do some plantal flexions for me, which involves her feet right here. And since the camera doesn't show her feet, I'll just kind of hold her feet up so that you guys could see. So I'm gonna have her bend her feet and lift it back. So all it is that forward and backward. Yeah. Then just extend it. And then, yep. And then she's going to bring it back. So she's going to do some dorsiflexion as well. And then I would have her do like 10 on each feet just to help her. So we're optimizing that blood circulation from her feet to her legs. So we're just optimizing her blood circulation. We want optimal blood circulation to the lower extremities, and these exercises to help with those. So after she does this feet, she'll go ahead and do the same thing to the other feet, and we would do it like 10 times. Like 1, 2, 3, 4, and you get the drift of what I'm saying. So that's what we're doing with those ones. So the next one that we're going to do is we're going to have her extend her foot. So we're going to do it at least maybe 5 to 7 times in the hour. I'm not saying that you have to do it. I'm just saying we will do it like 5 to 7 times in the hour. So all she's just doing is just extending and flexing her foot. So just extend and flex your foot. So that's all she's pretty much doing. Kind of the same concept. We're just looking for that blood circulation and optimizing the blood circulation in the legs, and we want to be consistent with those movements. We want to make sure that the patient is doing those exercises as well, that we're not just going to teach it to them and they're going to go home and they're going to forget. So we want to do it to where they're remembering what we're telling them, and it's easy enough to where they could remember. So hold on. To where they could do those exercises. So the next thing that we're gonna do is we're just gonna have her do some circular motions with her that was like this. Circular motions with her feet. So just yep. So we're gonna do it 10 times to the left, and then we're gonna try to do it 10 times to the right. Could you do it the opposite way? Possibly. Maybe like this one, like this and this. Yeah, could you do so you do 10 times somewhat that way, and then you do 10 times this way. Okay, and let's try to do the other leg as well. I'm just holding her leg up so that you guys can see what she's doing. So we're gonna repeat it. We're just gonna do it like 5 times, 10 times on each leg in the hour. Not too long that is overworking. It just kind of, we want to do it both ways. And we're just going to repeat those circular motions. So this also helps to promote, everything that we're going to do is for the promotion of the blood circulation. And this one will help the promotion of blood circulation in the foot. So we're focusing on the foot and the legs. Sorry if my legs is losing feeling. And that's pretty much all there is to our leg exercises today. It was nothing taxing or anything to where the patient will feel like, oh, this is too much work. It's just simple, holding your knees up for 2 to 3 seconds, helping to get that blood circulating through the lower extremities. Then we're just lifting our feet up and down, also helping with that blood circulation. And doing that, just all of these movements, we could do all these movements between 5 to 10 times in the hour. It wouldn't even take 30 minutes to get those workouts done in an hour. So 5 to 10 times each leg of the movements to help the blood circulations in the lower extremities, the low in the feet and in the legs, help to prevent any kind of clot. We just want to do those exercises as many times as possible as we can and just keep it going. And that is all we have for you. If you did wear gloves, you want to take those gloves off, and you want to do some hand hygiene again before you even see the next patient. And even if you do hand hygiene in that patient room, you still have to do hand hygiene when you go to the other patient's room. And that's all we have for you guys today. Thank you for watching.